lesson, we're going to talk about second degree AV heart block type 2. It is also called Mobitz 2. So this rhythm is a little more dangerous than second degree type 1 because it can cause third degree heart block. And so it's a very important rhythm to identify, and so we can respond to it quickly so we can prevent complications. So let's go ahead and start talking about it so you can become more familiar with it. So in second degree AV heart block type 2, the impulses have difficulties reaching the ventricles just like in type 1. However, just like in type 1, we also end up with a dropped QRS here. So this is basically what happens. Here's our heart, and here's the SA node, AV node, bundle of His, right and left bundle branches, and Purkinje fibers. So what happens is sometimes the AV node prevents some of the signals from getting to the ventricles. So the ventricles don't contract, so we do not see a QRS. So every now and then a QRS is dropped. It can be because of the AV node malfunction, or it can be because of the bundle of His or Purkinje fiber. Something in the ventricles or the AV node itself prevents the signal from getting down. So some impulses get down to the ventricles like normal, and the ventricles contract, as you can see here. But then other times it just does not go down at all. Ventricles do not contract. So we have a missing QRS like you see here. This rhythm is so dangerous because it can set people up for going into third degree heart block or complete heart block, which is why we got to make sure we identify it quickly. So let's go ahead and break down the characteristics of it and do the 6-step method. So in step number 1, we have got to look at the rhythm and find out if it's regular or irregular. So if we count some boxes from here to here, we have about 20. From here to here, we also have about 20. Now from here to here, we're going to have 5, 10, 15, 20, 25, 30, 35, 36, 37, 38, 30. We have about 39. So obviously it is regular for the most part, but irregular when we drop the QRS. So we're going to call it regular and irregular. In step number 2, let's count the heart rate. And we have 1, 2, 3, 4, 5, 6. So 60 beats per minute. 1500 method would be inaccurate because it's irregular. So we would count the pulse, the apical pulse, for a full minute. In step number 3, we got to do the P to QRS ratio. Do we have one P wave followed by one QRS? And we do. If you look at this, every P has a QRS behind it, except right here where we drop a QRS. If you were to see the remaining part of this strip here, we would also drop a QRS. So the P to QRS ratio is 1:1, but it varies when a QRS is dropped. In step number 4, we've got to do the PR interval. Now, I want you to focus in on this. In second degree AV heart block type 1, the PR interval would get longer and longer and longer, and then we drop a beat. In second degree AV heart block type 2, the PR interval is actually normal, and then we drop a QRS, okay? So if we measure this one from here to here, we have about 5 boxes, so 0.20 seconds. From here to here, we have 1, 2, 3, 4, 5 boxes as well. And this one to this one, we have 1, 2, 3, 4, 5. And then we drop a QRS. So if we were to start measuring from here to here again, when it picks back up, it is also normal. So I need you to remember this. This is the biggest characteristic. The PR interval is normal, and then a QRS is dropped. Okay? And then in step number 5, we got to look at the QRS complex. So let's go ahead and measure this one. So from here to here, we have about a little over a box and a half. So let's just go with 0.06 seconds. And then in step number 6, we identify the rhythm, and it is second degree AV heart block type 2. So let's recap the characteristics. The rhythm is regular and irregular when we drop the QRS. The heart rate is they're usually slow, okay, because there is some type of AV heart block. The heart rate is for the most part slower than normal. The P to QRS ratio, for the most part, it's 1:1, but it varies when it is obviously not there when the QRS is dropped. The PR interval, this right here is what you have got to remember. The PR interval is normal until a QRS is dropped. And then the QRS complex is normal as well. So one easy way to remember this is by asking, hey, let's look at this rhythm. Did we drop a Q? Okay. Did we drop a Q? Yes, we did. Well, then guess what? That's a 2. Once again, look at the rhythm. Did we drop a Q? Yes. Great. That's a type 2. Okay. Did we drop a 2? Yes. That is a type 2. So I hope these little simple things help y'all to be able to understand the difference between type 1 and type 2. So let's talk a little more about it. So because second degree AV heart block type 2 is a little more dangerous, people will have signs and symptoms, and they are usually not asymptomatic. Think about this for a second. If we are dropping a QRS every 3 to 4 heartbeats, that means every 3 to 4 heartbeats, the ventricles are not contracting. What do you think is happening here? Cardiac output is decreased because the ventricles are not pumping. So this is why people will have signs and symptoms of lightheadedness, syncope, dizziness. If severe enough, they can get hypotensive. And depending on the bradycardia and how many QRSs we are dropping. So the main nursing interventions are to assess the patient right away and find out if they're stable or unstable, get some vital signs, notify the doctor. While this is happening, you got to prepare to get a temporary pacer in the room to prevent them going from, well, you can't prevent third degree heart block, but you can actually try to have the pacer ready so you can pace them. So let's talk about that. So therapeutic management, you got to follow the ACLS guidelines. If they are very, very symptomatic and very bradycardic, we can do atropine. Temporary pacemaker, we can prepare them for a transcutaneous pacemaker. If y'all remember, this is where, here's my patient. One day I'll learn to draw without the arms being so big. He's not feeling so good. So here's my machine. I connect them to the pacer leads. And I turn the machine on to pacing. And so it sends, so we'll do it at 60 beats per minute. So at 60 beats per minute, it is sending electrical impulses to the little pacer wires and transcutaneously gets down to the heart. So the heart is being shocked and it's pacing. This is done in case they go into third degree heart block or if the second degree type 2 is severe enough and they are unstable and very symptomatic. Another treatment option would be a permanent pacemaker. And again, this tries to keep things in line to prevent third degree heart block. They are in such a high risk from going into third degree heart block that when we see this rhythm, we have got to do something about it because third degree heart block is a deadly rhythm. And this is like one step away from there. So we got to try to catch it early to prevent complications. So the key points and the biggest takeaways from this lesson are to remember the abnormalities of second degree AV heart block type 2, also called Mobitz type 2. And this is where the electrical conduction is not reaching the ventricles. Usually it's because the AV node is malfunctioning, or sometimes some electrical conduction in the ventricles just prevents that from getting down to there. So because of that, there's a dropped QRS. The ventricles do not contract when we have this dropped QRS. The main nursing interventions are to identify this rhythm quickly and put some pacing leads on them in case they go into third degree heart block. Treatment, if they are symptomatic and very bradycardic, we can do atropine. And for the most part, these people end up with a permanent pacemaker, again, to prevent further complications. So this slide right here, I want to compare the differences between the two. So if you can figure out a way to print this, write it down, memorize it, this will help you. Second degree AV heart block type 1 is also called Mobitz 1 or Winky Bach. Second degree AV heart block type 2 is only one other name, Mobitz 2. So if you can remember the Mobitz 2, type 2. Mobitz 1, type 1. And then Winky block just comes with type 1. Now, this right here are the biggest characteristics that you have got to remember that will help you identify them on an EKG. In second degree AV heart block type 1, the PR interval is progressively getting longer, and then we drop a QRS. So we will have a P wave, QRS, and then P wave, and then our QRS gets, our PR interval gets wider, and then P wave wider. I know this is very exaggerated. And then all of a sudden we have a P wave and no QRS. Okay, so progressively gets longer. The PR interval progressively gets longer, and then we drop a QRS. In second degree AV heart block type 2, the PR interval is normal. So if you just look at it, it looks like a good looking sinus rhythm, but then all of a sudden we start noticing that we keep dropping QRS. And that is a second degree AV heart block type 2. Okay, where it looks okay, and then periodically we're dropping QRS. Now, second degree AV heart block type 1, for the most part, is pretty harmless. And unless they are asymptomatic, you can just continue to monitor them. Because second degree AV heart block type 2 can lead to third degree, a deadly arrhythmia, you have got to do something about it to prevent complications if they do go into third degree heart block. So prepare them for a pacemaker, either temporary or permanent, and have medications ready in case they are very, very bradycardic. I hope this slide helps so that you can compare the two, and then when you see them on an EKG, you can look, oh wait, our PR interval is getting longer, and we drop a QRS, great. Do we have winky, winky, winky block? Great, that's type 1. Does it look like a normal sinus rhythm or sinus bradycardia, and then all of a sudden we're dropping Qs? Well, that's a 2. Okay, again, hope these little things like that help. So I hope that you guys have enjoyed this lesson and understand the difference between second degree AV heart block type 1 and type 2. Make sure that you guys check out the resources that are attached to this lesson, because there's a lot of cheat sheets that help you differentiate between the two. And keep practicing. Keep looking at different rhythms so that you can identify the difference between type 1 and type 2. Now, make sure that you guys go out and be your best selves today. And as always, happy nursing.